Hi, everybody. Good afternoon. Thank you for joining us. This is the fifth event of this sustainability lecture and dialogue series. Sustainability addresses the interconnectedness of the environment, social equity, economy, and aesthetics. There are many challenges at this intersection of these spheres. One such challenge is housing. Today's theme is social and environmental justice, addressing housing and community disparities in Greensboro. And we will hear from Dr. Stephen Sills. Dr. Sills is professor of sociology and director of the Center for Housing and Community Studies. For the last 14 years, Dr. Stephen Sills has conducted housing and community-based research in North Carolina. He has served as the investigator, evaluator, and consultant on over 100 applied and community-engaged projects. His projects often employ community-based participatory research frameworks to leverage local resources to empower residents. He has received many grants over the years. I learned today that over 45 funded projects are currently in progress. That's really extremely impressive. Most recently, he was awarded a fellowship and grant for the Interdisciplinary Research Leaders Program of the Robert Woods Johnson Foundation for an environmental justice project in East Greensboro. Please join me in welcoming Dr. Stephen Sills.
There we go. Thank you so much for that introduction, and welcome everybody. I'm going to be going through the root causes of inequality as they're framed in Greensboro specifically. You'll see that some of these causes are universal, and they're issues that we've been talking about for the past 8 or 9 months during COVID, impacting many of the members of our community, but they're rooted in issues more than 100 years old, policies that have created inequitable and disparate outcomes. I'll talk about how these policies have resulted in concentrations of poverty, specifically in East and Southeast Greensboro. I'll talk about how that poverty and lack of wealth building over the past century has resulted in reliance on rental housing in those neighborhoods, and how that rental housing is now unaffordable to many members of the community. I'll then talk about 4, 5 projects that the center is currently engaged in to address some of these social and environmental injustices. And as Sean mentioned, put questions in the chat. I will try to monitor that at the same time on a single screen for this presentation. So I'll try to keep an eye for that pop-up box in case you have any questions. So we're going to talk just a little bit about root causes, segregation, redlining, and the racist planning practices of the last century or so. And I see that Shoni's coming in with us here too. There we go. Has anybody read The Color of Law by Richard Rothstein? This is a great book. Yes, good book that really frames this issue. And it talks about how this isn't just a localized issue in the South. It's not something just an East Coast issue, but an issue that is universal to the United States. The policies of the 20th century are still plaguing us today. They've created bifurcated cities like Greensboro, where we have people of color, people of poverty, people in poverty, segregated to particular sections of the city historically, and continuing those patterns today. These were racially explicit policies. They were embedded in a racism that was by law, and structurally creating impediments for anyone within communities of color to achieve what was on par with the white communities in many places just across town. Here's Greensboro today. This is 2020 American Community Survey data. So it is the most recent census data available. And we see that in neighborhoods in East Greensboro, this is at the block group level, so the neighborhood level, neighborhoods in East and Southeast Greensboro are 80% or more African American alone. This means someone is checking just the box, Black or African American, on a census survey in these neighborhoods in East and Southeast Greensboro. This is the pattern that we saw in the 1920s, in the 1870s, and before. At those times, it was de jure by law that these neighborhoods were the only places that a person of color could live by racial covenant and restrictions. Today, we still see that impact, de facto impact of racialized planning playing out in the demographics of neighborhoods in East Greensboro. And I'll even add that some of these neighborhoods are 95% African American or higher, while the map is showing us 80% or above. So we have a situation of separation, segregation occurring in Greensboro. The bifurcating lines are US 29 North and east of that, Elm Eugene through downtown, and Market Street on kind of that south border and south. Some places it might be Gate City Boulevard and south. We can see that there are neighborhoods to the north and west, starting with Irving Park and moving outwards, kind of in a wedge shape, that are less than 15% white. Sorry, less than 15% African American. These are majority white neighborhoods. So this pattern of segregating ourselves by color, by ethnicity, continues even 100 years after policies were struck down. Let's go back to 1937, Homeowners Loan Corporation. This corporation operated between 1933 and 1954, though most of its lending was between 1933 and 1940. Originally, a means to put money out to help struggling homeowners maintain their homes. This was the original Fannie Mae, the mortgage lender for most of American homeowners during this time period. And it segregated or identified neighborhoods by risk. Green areas were low risk, high security areas. The bluish areas were second grade, yellow areas third grade, and red areas fourth grade. Red has become known as redlining, and we can see from a map of Greensboro that neighborhoods in South and Southeast Greensboro were redlined in the 1930s. This policy meant that even if you were a homeowner in that neighborhood, you couldn't get a mortgage through the Homeowners Loan Corporation or the banks that they were working with. If I wanted to refinance a home, if I wanted to sell a home to another person who would purchase with a mortgage, I was not likely to be able to because of the redlining. This meant that housing in those neighborhoods became devalued. They had to be accessible by cash and not by mortgages. So capital was very difficult to get. Hello? Okay. Capital was very difficult to get. And one of the impacts was to suck equity out of the redlined areas. Also transferring many of the homeowner occupied homes to investors who were speculating on those homes as rental properties. Now, during this time, we had mixed income neighborhoods in these same red areas, African American neighborhoods that had wealth, that had business class, working class, owners of capital, people who were on city council, physicians, et cetera, living together in these neighborhoods. So mixed income, mixed class, mixed education. That's a healthy market. Until this time, those markets were stable, and there was a level of affluence. So if you drive through areas of East Greensboro, you see some of the remaining housing from the late 1800s and early 1900s, where there was some affluence still in that community. Much has been torn down since. So according to this very recent paper at the Reserve Bank of Chicago, we see that the redlining has led to reduced home ownership rates, house values, rental, and increased racial segregation in decades after the redlining. They've made comparisons to communities that did not have these homeowners loan corporation maps and see statistically significant differences in the patterns that have emerged in the century since. This is Greensboro 2018 data, where we constructed a market segmentation for the city. And we started at the parcel level with quality of homes, a 54-item survey of the quality of the structures on the parcels, and combined that with about 22 other measures of market stability. And we see that the neighborhoods in East Greensboro in 2018 were considered extremely weak markets relative to the rest of the neighborhoods in Greensboro. The neighborhoods of Northwest Greensboro being the most stable. One of the underlying issues here is the wealth gap that has emerged between Black and white communities in that century since the Homeowners Loan Corporation maps came into existence. My grandparents owned a home. They were able to pass on at least part of that home ownership wealth to my parents, who may at some point pass on some wealth to my generation. Over the course of the past 4 or 5 generations in the white community, even middle-class families have been able to accumulate more wealth than African-American communities of similar economic beginnings, similar educational backgrounds, similar workforce positions. In fact, on average, white families hold 6.5, almost 7 times as much wealth as Black families. And we've done a number of different regression analyses to see controlling for sizes of family, controlling for location, controlling for educational attainment, et cetera. And we still see the Black-white wealth gap playing out. One of the key elements there is the lower rates of home ownership that are occurring within Black communities. That last bullet by the Urban Institute really underscores that wealth and parental support being passed on intergenerationally is key in home ownership. Housing has become too expensive for young people in the family forming years of 25 to 35, often to afford without assistance from parents. Parents who have most likely paid off their mortgages by that point, or are able to borrow against equity in their homes and assist their children. So let's talk a little bit about some of the impacts of the wealth gap and some of the impacts of racialized planning of the early 20th century as it plays out in Greensboro. Population in poverty. We see that the map of poverty is very similar to the map of color in Greensboro. East, South, Southeast Greensboro having higher rates of poverty. In fact, we'll look at just a few neighborhoods where poverty is in excess of 40% and as high as 70 or 80% in some neighborhoods. These neighborhoods are East Bessemer and Summit Avenue, just north of NC-A&T, east of A&T, Bessemer neighborhood, the Cottage Grove neighborhood, the Willow Oaks neighborhood, which was redeveloped earlier in the 2000s under the Hope 6 program, where they took Morningside homes and raised them, a 500-unit complex of public housing, replacing them with mixed-use, owner-occupied and rental homes in that neighborhood. Nacho Park, which is just south of A&T, a lot of student housing there, more recently acquired by A&T. South of town, we have the Warnersville neighborhood, Prince of Peace in that area. Smith Homes, the other large 1950s public housing complex that was built and is currently undergoing what's called RAD conversion, which will turn it into a managed Section 8 apartment complex, and then Oak Grove. Parts of the Glenwood neighborhood, the south portion towards Freeman Mill Road. I'll note that that north portion that is, highlight it here. This north portion right here is kind of an anomaly. This is now student housing. This is Spartan Village. Essentially, studentification has occurred here, where we've torn out about 1,000 affordable units and replaced them with student housing. Hillsdale Park, further east out towards Merritt and South Holden, just south of Smith High School, a number of condos and apartment complexes out there that are lower income. Finally, UNCG, again, another anomaly here. Wherever you have students who are only part-time employed or unemployed, it inflates the poverty statistics. Areas where poverty is persistent, though, we see more in those East Greensboro neighborhoods. These are neighborhoods where we see the percentage of people living in poverty is over 20% for the past 3 decades. What is the impact of this? Low access to healthcare. These are areas that are designated as medically underserved areas by the health DHHS. These same neighborhoods have very few dental offices, very few vision clinics, very few primary care providers. There are only 2 or 3 primary care providers in this area, and do not have access to healthcare on a regular basis. These are the areas designated by the USDA as being low income and low food access, or just low income, low food access and low transportation access. Those are overlapping areas. Many people refer to these as food deserts. If you have low transportation access, more than a quarter of the population not having a vehicle, with 40% of the population having low income and no supermarket within a mile radius, then you're experiencing difficulty in accessing food that is healthy on a regular basis. These same neighborhoods that we've indicated have also been identified by various means as having low quality of housing. This is not that the housing was poor when it was built in the 1920s or 1940s or 1970s, but that it has been poorly maintained over time. In the first map on the left, the Center for Housing Community Studies conducted a parcel level review. And this is the index, the summative index of all of our measures. We've broken out some of the measures there to the right, houses with poor roof conditions only, or houses with bad foundations. But we've also matched this data against local code enforcement information and see that the patterns are sustained. The same neighborhoods where rental rates are high, where poverty is high, have poor quality or substandard housing conditions. These poor housing conditions, these medically underserved neighborhoods, these high poverty areas also have poor health outcomes. These are correlated factors, but seem to hold up when done in regression analyses as also causal. This, for example, is admissions to Cone Hospital Emergency Department or clinics during the fourth quarter of 2016. And the areas correlated with poor quality housing. We ran regressions looking at housing quality while accounting for educational attainment, home ownership, income statuses of households, and found that housing quality was a significant predictor of asthma admissions rates. So I'm going to talk just a little bit about some of the other affordable housing issues, specifically as it relates to renters in these neighborhoods and the squeeze that they're experiencing or the cost burden. If it will go to the next one. I'm stuck on pin. There we go. So one of the impacts of the recession between 2009 and 2013 was a displacement by foreclosure of those who had entered the housing market later. So if you bought a house in the 80s, 90s, or 2000s, you were more likely to be foreclosed on during the recession than those who had bought in previous decades. More importantly, if you had bought since 2000, you might have been a victim of predatory lending, of subprime lending rates, of issues with over purchasing for incomes, and that segment of the population was very precarious and highly likely to be foreclosed on. We moved from about 45% renter households to 51% households in Greensboro during that time. And this is the most recent figure, 51.3% or 63,000 households in Greensboro renters. We see that you're more likely to be a renter in East and Southeast Greensboro, but also out I-40 as we've had expansion along that area, the neighborhoods west along that route between Market and 40, where new apartment complexes and new developments have occurred there. Rents are highest, though, along that corridor that I was just mentioning. Friendly and Market areas out towards Guilford College, rents are in excess of $1,000 a month for two-bedroom houses. Rents are still fairly affordable as an overall affordability in East Greensboro, South Greensboro. Rents are highest in the areas where there's the lowest availability of rental housing and the highest availability of home ownership. Rents on average in Greensboro, around $850 gross. That rent has been steadily increasing. Between 2012 and 2020, about a 59% increase. So in 8 years, rents have gone up 59%. Incomes have not followed. Incomes have not kept pace with the increases in rent. That has resulted in a higher and higher percentage each year of residents experiencing a status called cost burden. Cost burden means they're spending more than 30% of their gross income on housing and housing related expenses. That's about 48% of all renters are cost burdens, half of renters, and about 24% of homeowners. And among homeowners, we see that those who are elderly are more likely to be cost burdened than those who are younger owners. One of the impacts of being cost burdened is that you are more precariously housed than others. You're more at risk of eviction than others may be. We've seen our eviction rates in Greensboro being some of the highest in the nation, and we'll talk about that a little bit more in a moment. Currently, 2019, the best data that we have from the AOC, the administration of the court, is that there were 11,000 evictions filed in Guilford County in 2019, and about 80% of that is Greensboro. 11,000 filed, about half of those result in what's called a writ of possession. This is when the sheriff comes and padlocks and moves out a renter. In between the summary ejectment filing, the eviction filing, and the writ of possession, some people are able to pay the landlord and preserve their tenancy. Some people end up moving out without there being a final writ of possession ordered. So there's a variety of outcomes there. So between 5,000 and 6,000 individual households are evicted annually currently. That rate was just a bit higher in 2016 when we saw 16,000 summary ejectments during that year. We were 7th in the country for eviction rates according to Princeton's Eviction Lab. If you've read the book Evicted by Matthew Desmond, Desmond became the PI on a project called the Eviction Lab at Princeton, which is now accumulating data from across the country on eviction rates. We were #1 in the state of North Carolina in our eviction rate per renter households of mid and large size cities. About 14 evictions daily in 2016 and holding just a little bit below that now. This is a map of evictions in Greensboro. We see that evictions were disproportionately in South and Southeast Greensboro, in many of those same neighborhoods where we saw high rates of poverty, high rates of food insecurity, medically underserved neighborhoods, asthma rates, etc. Let's turn just a little bit to environmental justice issues. We're going to talk a little bit about toxic and marginal lands and how this relates to housing environments. This is from that redlining map. And I've circled the neighborhood, which is Cottage Grove today. And there's a dot on this map that is very significant to us, right here. This little dot right here. It's hard to read, but it says incinerator. And just north of it, it says cemetery. This area right here is what we're concerned with in 1937. This is from the Greensboro Patriot, 1922. The city of Greensboro is trying to figure out where to put an incinerator and landfill. That was the incinerator we saw in 1937. In the end, they had purchased 10 acres from an African-American family, Walter Huffman, was the name, but it was the Huffman Sykes family. And it was actually more than one owner. Many properties at this time were passing through heir rights, HEIR rights, rather than deeds registered with the county. Walter Huffman and the Sykes family owned this 10-acre part of a farm in outside of East Greensboro. You can see that there was resistance. Indignant over incinerator site, citizens of South Greensboro draw up a resolution opposing the incinerator on the South Buffalo Creek. Nonetheless, the city was able to purchase this land and establish an incinerator for wastes from the white parts, the west and north parts of Greensboro, to be trucked out East Market, burned, and then dumped in this lot just south of what was an African-American cemetery and what was at that time a small community of African-Americans. And it's still wanting to draw. There we go. So here's that red line map overlaying another map of the neighborhood of Cottage Grove. And if it lets me disappear that, we see the Cottage Gardens Apartments Complex, which is the new name for the Avalon Trace Apartments that were built first in 1959. We see New Hope Development Corporation, which is a community organization associated with New Hope Baptist Church that's trying to develop areas with affordable housing. We see Apache Street Park, we see Bingham Park, and we see Hampton, the site of the former Hampton Elementary School that was rendered unusable in 2018 April due to a tornado. What we don't see is the fact that this park right here is where the incinerator and landfill were. It is bifurcated by a tributary of the South Buffalo Creek. That creek passes under what is English Street and over by Hampton Elementary School. The landfill actually extended east along Hampton's land. And then the creek continues on until it meets up with the Buffalo and then finally the PD. So this is about a 12-acre parcel, Bingham Park, and about a 16-acre where Hampton Elementary stands, now vacant. Along that north tributary, we see a small creek that on any given day has about 20 shopping carts and refuse in it. This is behind the Cottage Gardens Apartments, blocking the flow and causing some environmental issues to the quality of that creek. Moreover, I'm going to jump just ahead here a second and then jump back. This is what we see along the creek bed that cuts through where the landfill used to be. We see that the creek actually is eroding the materials that were buried in between 1923 and 1925 and 1953 in the incinerator and landfill area. Jump back just a moment here. So there have been a series of EPA brownfield studies, 2 phases by City of Greensboro, and now 3 phases of NCDEQ studies of the soil and water conditions in this former landfill, now park. They have found arsenic, iron, lead, manganese, as well as volatile and semi-volatile organic compounds coming from the buried landfill and in the stream bed. The pink squares are parcels, and on those parcels are people. People live right next to, and in some cases, right on top of the landfill. Kids play in this creek. We have oral histories from members of the community in their 80s who talked about playing in the creek, catching crayfish and eating blackberries on, that grew along the creek banks. At Hampton Elementary School, where lead and manganese and other heavy metals have been found, there was a playground, a baseball diamond, and every day, many of the families who lived in this section of Cottage Grove would walk across the creek, bouncing on rocks to get to the school. So lots of interaction. This is from NCDQ's mapping system, and we see a designation for pre-regulatory landfill site, as well as some other EPA concerns in the neighborhood. These are disproportionately in neighborhoods of color when we map them across the state and across our own city. Here's another aerial view, and you can see where the creek bed lies, where the boundary in red of the former landfill is, where it extends over onto the land that Hampton occupied. So what are some of the potential health impacts? Well, we know that these substances, lead and other heavy metals, have been associated with asthma, reproductive issues, birth issues, cancers, thyroid issues, immunotoxicity, etc. Multiple sclerosis, Alzheimer's, brain necrosis, death have all been correlated. So this is the lay of the land. This is the social and environmental justice issue that we are trying to address. And now I'm going to talk about 5 projects that UNCG Center for Housing and Community Studies is involved in as a partner with community to address some of these issues. First, let's talk about housing quality and its correlation with respiratory illnesses, in particular pediatric asthma. Under the Invest Health initiative funded by Robert Wood Johnson Foundation and the Reinvestment Fund, through 2 rounds, 6 years now, we've been working in partnership with the City of Greensboro Neighborhood Development, East Greensboro Now, a community development organization, Cone Health and its community outreach, forgetting a partner, and the Greensboro Housing Coalition, 5 key partners in addressing the conditions that exacerbate asthma. We're in fact number 3 in the country in 2019 for the Asthma and Allergy Foundation for asthma issues, quality of air, flora and fauna that contribute to asthma conditions. But the underlying issues are medical, access to medical care, high poverty, and quality of housing. By combining the different studies we've conducted over the years, respiratory related admissions to the hospital, quality of housing studies, we were able to actually target specific neighborhoods and eventually specific apartment complexes that were contributing to the disproportionate numbers of emergency department visits. Here, for example, is Avalon Trace prior to its purchase and conversion by an East Durham developer. It was a 176 unit complex, which by this time, 50 units had been condemned. It had over 120 annualized visits to Cone hospital for respiratory related issues, more than 30 of those being pediatric asthma cases. After we were able to help the East Durham, first to get the property on the market and then the East Durham developer to purchase the property, we assisted in getting a bridge loan that allowed them to invest almost $2 million in rehabbing the property. Another $500,000 from the city of Greensboro in a no interest loan to conduct weatherization work. This did not take a poor quality, what we call a D- or lower property and turn it into a luxury apartment complex. But it did solve the issue of people needing literally a blow up swimming pool in their living room whenever it rained. And that is a true situation. Several people in the apartment complex would set up swimming pools and buckets for when it would rain. It did solve the issue that when residents flushed their toilet, the sewer would come back out of their bathtub. It has removed carpeting as much as 20 years old, replacing it with slick laminate floors, upgrading HVAC systems, replacing windows with windows that actually closed and sealed, putting door seals in, painting interiors and exteriors. It is still a work in progress. Now even 2 years out, still an ongoing process. But according to new data from Cone Health, I saw that Meredith is on our call. Meredith's been working with us on this. According to new data from Cone Health, we see a reduction in the number of visits to the hospital from residents at the apartment complex, even as the apartment complex has more units now available, all 176 are occupied, and more families living there. So good measures of outcomes. UNCG's Center for Housing Community Studies also has a resource center in one of the apartment units there. We provide snacks and food from Backpack Beginnings and Out of the Garden Project. We have a project with UNCG's psychology department, Strong Minds, Strong Communities, providing mental health care access. There's a nursing clinic on Thursdays with students from UNCG's nursing department. We just received a Dollar General Literacy Award, which is providing 10 Kindle Fire Kids editions with libraries of more than 20,000 books, Scholastic Readers weekly, and about 400 new books for our lending library, as well as Dibbles assessments that we're doing pre and post to see increases in reading scores. We're matching UNCG, A&T, Bennett, and Guilford College students and volunteers from the community as reading pals with resident children in the neighborhood, even virtually during COVID. They've been able to do read aloud times through Zoom. We have a health impact team that was born out of the Invest Health initiative and all of the mapping that we've done, where we're using federal work study students, a team of 20 who've been trained in community engagement, in door-to-door canvassing, and conducting quick screeners, 2 to 3 minute questionnaires at the door, which indicate if there are respiratory illnesses, if they meet the qualifications for lead-safe housing screening, or for weatherization. This is up to $60,000 in community resources that could go to rehabbing renter or homeowner occupied housing. In High Point, we've just extended this project to include High Point, and through the Foundation for Healthy High Point, we also have $500 for some homes for minor remediation work to make sure that they are eligible for weatherization and lead-safe housing. if I can get my scroll there. This is one of those programs where we don't stop with a referral, but every 30, 60, 90 days, we call back and follow up, and we triage cases to make sure that we're able to get as many resources as possible to the residents that qualify. Often we're finding that there's a marketing gap between what federal and state and local resources are available and what people know about. If lead safe housing at the city of Greensboro is not going out into the neighborhoods, neighborhood residents aren't going to find out about it. If it's just on their website or just in a newspaper article once every 6 or 8 months. So by going out and knocking on doors, we're increasing the number of people who are being referred to and applying to these programs, and then we're helping them navigate the process of getting those resources. Here's one example case. We knocked on the door of Miss Mary on Gorell Street in East Greensboro. You can note from this Google Street View that she had some roofing issues that were quite apparent. We also found out that she did not have heat for several years. Because of the roofing issues and the heat, her house would have been condemned if we referred her for assistance in the city of Greensboro. Because of the roofing issues, the weatherization program couldn't fix her house. They had funds to replace the heating system. We had to help get the Housing Coalition and a local builder to replace the roof as a donated activity, a little bit of publicity on TV8 from it. And as a result, she was then able to get, through weatherization, new heat, some plumbing fixed, a ceiling fixed, and then some weatherization to windows, doors, vapor barrier under the house, and blown insulation in the attic. All things that she would have qualified for if she had known about, but didn't know about until we knocked on the door. With those who are facing eviction, we're working with the Greensboro Housing Coalition with assistance from the Community Foundation and the Z. Smith Reynolds Foundation to provide eviction resolution. This has become kind of supercharged under COVID as some CARES Act funding has also flowed to this program. This program gets referrals from a variety of resources to Greensboro Housing Coalition. An if-then scenario algorithm is used to determine if they're eligible for eviction resolution. They're then matched with legal aid case workers who review the case to make sure that we negotiate well for terms, for paying back rent, for making sure that the housing is good quality. They receive emergency rental assistance from GHC, who then continues to follow up with them for 30, 60, 90 days. And at this point, CHCS is providing evaluation and technical assistance to this program that we set up. This really resulted out of about 3.5 years of studying eviction resolution projects across the United States, as well as collecting local data on eviction. A new project that starts with a pilot of 5 cases in December, 20 cases in January, and then up to 100 cases thereafter is a mediation program, which will bring in pro bono lawyers, students in mediation and peace and conflict studies, Elon Law students to act as mediators between landlords and renters. It will work with the Eviction Resolution Project and Legal Aid and Greensboro Housing Coalition, but also with many other referral agencies. In fact, they're meeting right now discussing tenancy protections, Urban Ministry, Salvation Army, Welfare Reform, City of Greensboro, Faith Action, etc. Another spinoff out of this has been the Tenant Leadership Academy, in getting in front of the issue of eviction we decided that we needed to have on-the-ground grassroots leaders within low-income apartment communities, within public housing, within Section 8 housing. So with a grant from the Ford Foundation, we ran 3 cohorts of the Leadership Academy. They received 25 hours worth of training around how to organize, how to create an action plan, how to create a vision for their apartment community, how to get an apartment association together in their apartment communities. We're hoping to continue following up with this in the future with additional cohorts of the Leadership Academy, as well as providing technical assistance and follow-up to each of those groups that have been formed. Turning now to environmental issues. We know that housing is a container that impacts individuals' health, but we also need to address the issues at the neighborhood level of the environmental quality. First was the Water Resources Research Institute project to address issues of the creek water quality. We've collected environmental and oral histories of the neighborhood, documented through newspapers and county documents, city documents, the history of the landfill and the streams. We've done focus groups and charrettes with neighborhood members. We've engaged community cleanup days, which we're doing quarterly through the next 2 years. We've engaged with youth around environmental literacy and environmental education and environmental justice issues, and we're monitoring water quality. Researchers at A&T and in the geography department at UNCG have been assisting with this project. We're trying to remediate both the conditions that are caused by residents today, as well as those historic conditions from the past. These are some pictures from our last environmental cleanup day. We have another one coming up on December 5th, so if you'd like to volunteer, please let me know. Finally, through the charrettes with community members, we collected buckets of issues. We called this our bucket list. On the bucket list were questions about how and why residents would want to engage with advocacy about environmental issues. Why should people be concerned? Questions about what are the damages to the water, soil, and land as a result of having a buried landfill in their neighborhood. Questions about the impact of the landfill on human health. There's a lot of worry and concern in the neighborhood about the physical and mental health impacts of having contamination nearby. While NCDEQ says none of the contaminants are impacting health today, there's still a lot of fear and concern and questioning, skepticism about that. And finally, there are questions by the community around the proposed strategy from the Department of Environmental Quality to cap via a plastic mesh the remaining contaminants and not remediate them, not dig them out and haul them off. This is not trusted right now by the community residents, so there's lots of questions around that. These questions led us to our Interdisciplinary Research Leaders Program Award from Robert Wood Johnson Foundation, $350,000 award and 3 years with Sandra Echeverria in public health here at UNCG, Kathy Colville at Cone Health, and myself working beside community members to address these 4 buckets of issues. So through our project, we will look at medical records, death records, and see the associated impacts once geographically mapped. If there's a spatial correlation with proximity to the park, landfill, or stream, with health outcomes that we know could be correlated with the contaminants that are in the park. We're looking at the effectiveness of an environmental justice campaign to raise awareness and raise voice within the community. And we want to see that the community concerns and voices are heard by NCDEQ in the way that they choose to address both the Bingham Park land and, more importantly, the Hampton Elementary land. Together, that's more than 26 acres right in the heart of the neighborhood. The park and the school that had acted as central convening points that are sitting on top of lead, manganese, and other heavy metals and need to be addressed. So what are the key takeaways here? Principally, that these racially biased policies of the previous century have created segregated communities where people of color live on sometimes marginal or even toxic lands in neighborhoods where wealth and equity have systematically been mined from their families for decades. We need policies and practices that will push capital and resources into these distressed areas to address social and economic issues, not just to build our way out, that's how we end up with gentrification, but to redevelop the communities that have been impacted by these policies. And I argue that in the meantime, it's the place of the university, the healthcare system, advocacy organizations, and residents to co-collaborate, co-investigate, work together to directly improve housing conditions and environmental quality, and to put pressure on policymakers to address these issues. And I haven't seen if there are any questions in the chat box. There we go.
Thank you, Stephen. That's I'll give you a second to get some water and catch your breath there. That was just want to commend your work that you and your colleagues, some of whom are on this call, and that of the invested members of the community. It's a sad history, but I think it's a hopeful future that you're working towards. And yeah, really insightful. Learned a ton in this talk. Really appreciate it. I do see, yes, we've Stephen to give us permission to record it. We will put the video on YouTube, and we're actually building a web page for the previous talks that we've held so far. You guys are welcome to unmute yourselves now if you want to, turn your cameras on and ask some questions personally of Dr. Sills. Stephen, the one thing that I thought of while you were talking was, what resources are available through the Center for Housing and Community Studies or other resources like DEQ's mapping website that would be of use to community members? If we could, if I email folks and I could put links to those or something in the email. Certainly, yeah. We have accumulated literally thousands of data points for Guilford County on a number of projects, most with geospatial information. We have a strong GIS unit, strong evaluation and data unit with there are 4 PhDs and 4 master's folks working on these issues. We also provide technical assistance to community organizations. I've regularly collaborated with neighborhood associations and other organizations that are looking at very location-specific information. And so we've helped provide that or technical assistance around housing and neighborhood development issues. And we're building that even more. I will put a link to the website in the chat for everybody. Yeah. The other question I had, and I can't remember the name of the apartment complex that you highlighted where there was over 50 condemned apartments in there, but how is is it under the same ownership? I mean, yeah. What are the repercussions for landlords like this? Unfortunately, very few repercussions. So this goes back about 12 to 15 years ago to a group called Shannon Enterprises that owned
5 or 6 apartment communities across the city that were very similar to this. Legacy Crossing is one of them. There's one on South Holden, South Point apartment complex that you may have read about recently in the news. Shannon sold these as a portfolio to an out-of-state company in Georgia that simply took all the cash flow and didn't reinvest anything in the complexes. We call this equity mining, and there are many companies that do this. They just they take and don't reinvest. In the end, because of the public shaming that Greensboro Housing Coalition was able to do, the data was able to provide, the neighborhood residents organized with Josie Williams at the Housing Coalition. Those voices and that data were able to force the previous owner from Georgia to put the apartment complex on the market. You know, being in the newspaper every other day for how bad your apartments are motivates one to sell. The new owner, Carolina Community Investments, has done a phenomenal job, though it's a very difficult job. The older part of this were built barrack style, concrete slab, cinder block structure, very rudimentary and very hard to really update. She's made it livable, but it still has constant issues. Part of it has been, how do you do that and not raise rents? Most people would come in, raise the rent, and then, or improve it and then raise the rent to pay for it. And this has been a delicate balance, how to improve the quality without raising the rents. It has been since renamed now Cottage Gardens.
This is an issue that repeatedly comes up in sustainability research as well, as far as, you know, absentee landlords, particularly in single family housing, where we're their ineptitude and their blind eye to the maintenance of their houses, as those expenses are passed on to the renters. And I can speak from experience. You know, we've got a 20-year-old air conditioner that costs us an arm and a leg in the summer. But if they had just, you know, if they were, there's some sort of policy or law that would hold them to, you know, maintaining those types of that type of infrastructure, we'd be saving a lot of money, reducing our carbon footprint, all kinds of stuff, and health hazards and all of that. We do have a couple questions about where people can go to volunteer.
Just dropped it in the chat, go.uncg.edu/Buffalo Cleanup. And that'll take you to our Eventbrite site to sign up. We are limiting the numbers due to COVID. We pass out masks and gloves. We meet outside of the apartment complex, and then there's a little bit of instruction and all that goes on, and then we assign a segment of the creek to work on.
Great, thank you.
And Stephen, following up on that, if anyone is interested in volunteering with your center, do they contact you or?
Yes, they can send me an email at chcs@uncg.edu, and then I'll refer them either to, if they're interested in the Cottage Gardens Resource Center volunteering, I'll refer them to Tiara Brown, who's in charge of that, or to the Health Impact Team, and then Tisha Farmer, who's in charge of that. So.
That's great. Are there any last questions or comments from anyone?
I see that a lot of people found this extremely informative. So thank you so much.
I will send an email to everybody once we get the video up on YouTube, and you can also watch the other ones that we've had. And this will be our last event this semester, but we are planning on having more presentations and discussions in the spring. So again, I want to thank Dr. Kanafuchi for helping organize this, and many, many thanks to Dr. Stephen Stills at UNCG's Center for Housing and Community Studies for joining us today. We really appreciate it, Stephen. Thank you.
Thank you.
Thank you.
And many thanks to everyone for joining us. Y'all take care and be safe out there.
Bye-bye.